Hope in a bottle and history in the making. 70 hospitals across the UK, thousands offering their arms to the Pfizer-BioNTech jab. 90-year-old Margaret Keenan was the first at Coventry Vaccine Hub at precisely 6:31 a.m.
Hopefully it'll help other people to come along and do as I did, you know, try and do the best to get rid of this terrible thing.
Much has been made of the UK being the first in the world, which is to forget the 44,000 trial volunteers, half of whom had the actual vaccine. But this was not a day to split hairs. It was a day, in at least one case, to let go of all those pent-up emotions.
Well, it's been such a tough year for so many people, and there's William Shakespeare putting it so simply for everybody that, we can get on with our lives.
William Shakespeare not resurrected for a photo call, but an 81-year-old from Warwickshire who was the second person to be vaccinated today.
It could make a difference to our lives from now on, couldn't it?
And bringing with it maybe a light at the end of the tunnel.
Well, it means a lot. Hopefully, once it's rolled out to everyone, I'll be able to see my grandchildren again.
It has been a logistical nightmare and a marvel all rolled into one. The vaccine's limitations are well known now. It has to be transported and stored at below 70 Celsius. It needs to be thawed and can't be broken down from the pack sizes of 975, which is why the plan to first vaccinate care home residents had to be pushed to a later date, so there was no wastage. Instead, today it was patients aged 80 and over who were already attending hospital or who were about to be discharged, and NHS and care home staff. It is hard to believe that it is just over a year ago since they identified a new virus in Wuhan in China. They hadn't even given it the name COVID-19. And now, here we are, the first vaccinations. The health secretary's called it V-Day. There is still a long way to go, but there is finally a glimmer of hope that one day soon this will be over. And hope was everywhere here at Milton Keynes Hospital. It brimmed with eager staff and eager older people.
Which way do you want me to faint, left or right?
Tell me what the year has been like for you.
Isolating, so, grandchildren, missing out on them, missing out on hugs, and we had a great granddaughter, she's nearly going on for 2, and we just couldn't sort of see her or anything.
Well, I don't like injections because when I was in the forces, I had hundreds of injections, but it's one of those things.
Why did you want to have the vaccination?
I was offered it because I've been a volunteer down here and that sort of thing for quite a few years, well, nearly 20 years actually. And they offered it to me so that I can be safer to come back in and carry on.
It's been a hard year for the staff too, and today's vaccinations was one more ask of them.
NHS staff have worked extraordinarily hard, and I'm so proud that they have been at the forefront of the response to this pandemic. We've got yet another couple of months of this. We've got even more tough times ahead, and that's why we are asking the public to, yes, step forward and have your vaccine, but also to follow the rules that we're asking.
Today is just the beginning. The BioNTech Pfizer vaccine works after 2 injections 3 weeks apart. 12 days after the first dose, you get partial immunity. 21 days is the second dose, and a week later is full immunity, or at least in 95% of cases. So those being vaccinated today will receive the second jab on the 29th, with immunity from the 5th of January.
It's amazing to see the vaccine coming out. It's amazing to see this tremendous shot in the arm for the entire nation, but we can't afford to relax now.
And there are still unanswered questions. The vaccine stops people becoming ill, but it's not known if it prevents transmission, nor is it known if there will need to be booster jabs. The UK has ordered 7 vaccines, 40 million from Pfizer and 100 million from Oxford AstraZeneca. And a peer-reviewed study published today confirmed their vaccine is safe and effective, although it's still not clear why the trials showed that a half dose and a full dose were more effective than 2 full doses. The medical regulator, though, is expected to approve their vaccine shortly.